the baby develops. This is from the tiny being to up to about 5 months.
Okay.
This is the same the in a pictorial form. The previous one is just a line diagram, and same thing that it depicts the baby's features more in a better way, and it is again the rather photographic presentation of the same thing. And that is how the baby is growing inside you. And that is the baby from about 5 months to the 40 weeks or the complete term.
It looks like a miracle.
It is indeed a miracle.
Certainly
It is indeed.
Yeah, and hearing it from these specialists out here is like very delightful. But anyway, what I was trying to ask you, Doctor, as I was discussing with you previously before the show, is that we were speaking about heartburn and constipation. How do pregnant women, especially the first timers, how do they deal with it properly?
Yeah, heartburn and constipation, that is a part and parcel of this kind of pregnancy, because most women, about 60-70% of women, they do experience in heartburn, and this is due to the hormonal changes in the mother. That is what happened in the mother. So because of that, there's a slow movement of gut, and that cause a lot of acids to collect. So this because of that you get the heartburn. Other thing is in the first 3 months with the nausea and vomiting, and you don't eat anything. So there's nothing inside.
Yeah.
So these are the two things that contribute to this heartburn. Right?
Okay.
And in addition to that, if you are suffering from gastritis before the pregnancy, then that will be worse, and that kind of individual.
Okay.
So constipation also same thing, and the women who neglect constipation, then they will end up with piles, that is called hemorrhoids, right?
Okay.
And so constipation has to be addressed vigorously, and they have to increase lot of fiber contents in the diet, and they have to drink a lot of water to get away the constipation.
That's the only solution that we have.
There are
have a lot of liquids. And
there are medications, but leave it aside, and we want to promote the natural things first. Natural thing first.
Right.
Well, on that note, we do have to take another commercial break. I'm dying to know more about this.
The burning issue, literally.
Exactly, because it is an important topic regarding in today's context.
Yes.
And we'll be back after this commercial break as well. Do not forget to like us on our Facebook fan page as well. It's www.facebook.com/Good Morning Sri Lanka. We'll be right back on Good Morning Sri Lanka.
Welcome back to Good Morning Sri Lanka. We are still with the veteran doctors right now, and we're still talking about pregnancy, and we're learning a lot as a matter of fact.
And we will be talking about pregnancy as well, right through the show today.
Yes, true. Alright, so we have more questions to ask these very wonderful people over here, but then the most vital question that I wanted to ask before Banu's question arises, because I know that Banu has a very interesting question too.
Very.
What are the things that pregnant women should worry about, should be concerned about when the due date is near?
Well, the first thing that you should worry is whether you go into labor. There are two things, that your well-being as well as the baby's well-being.
Okay.
And if you are going into labor, there are maybe few signs that can happen. One is that you will get obviously the pain. It is coming in bouts. It is coming it is you get one pain, then you get another pain in about 10 minutes or 15 minutes. But if it is labor, this time interval tends to get shorter.
Okay.
So, and the intensity of pain also goes up.
Okay.
So I think that is a concern. And then if your water breaks and if you start leaking water, or if you bleed, or on the other hand, if you don't feel the baby is moving to the same intensity as the baby was moving before. So these are things that you have to be really concerned. And I always like to say that if you feel something odd or different to any other day, that may be the warning sign or the beginning of a problem. Like women tend to get increased blood pressure towards the end of the pregnancy, and anytime, as a matter of fact. But these are the things that you should really be vigilant about and keep in your mind, and to try to get some attention with the medical staff.
So even if you are going into a little faintishness or fatigue, do you have to worry about that also?
Not necessarily, but if it is continuing,
you need to be concerned.
more than that, you may be used to it. But if you all of a sudden, if you get fatigue, if you get
an abnormal
abnormal feeling, you get giddy, that may be a beginning of a problematic sequence of events. So no harm in seeking the medical advice, because you not necessarily need to go to the doctor, because you have the midwife. That each and every Sri Lankan mother is blessed that they have to be registered with the midwife, and she is knowledgeable to give you a sort of a satisfactory answer and to assure you or direct you to the proper place. So I think that we have to be proactive and try to take the service of them.
Okay.
Yeah, can I add something to Harsha?
Yes.
The other thing is that if closer to the pregnancy, if there is a bleeding from the vagina, or if there is a water is coming,
this is closer to the delivery.
And if there is a water is leaking, so that is a very important sign. As you all know, that baby is in the bag of water, so this bag of water is bursting. That is one of the signs of early labor. So if you have all this bleeding or this water leaking, then please come to the hospital without having had foods or drink anything.
Food.
Yes, that is very important.
Without eating, without drinking,
even water.
Even
water. The reason behind that is nothing by mouth. The reason behind that is
for how long is that? You need to fast for how long?
No, as soon as you get the signs.
Then avoid having anything and come to the hospital. Then we will recommend, if you are in a suitable situation, then we say yes, you can.
And
otherwise the reason is, if you want to do a urgent delivery, emergency delivery or emergency cesarean section, we need to have a fasting. Otherwise we are putting the mother in an unnecessary risk situation.
Okay, when the baby comes out, I've heard this, that you need to always take the baby out from the head, from the baby's head. What is it?
Is that called crowning or something?
Exactly. Explain, because we're clueless on that.
Yeah, we're a little clueless on that. On the side of.
Shall I go ahead?
Yes.
It is like this. When the baby is coming out of the birth passage, it stretches the vagina, and so it comes and stays at the opening. So that is, we call crowning, like that you have the vaginal skin right round your head. So that we call crowning. But the baby doesn't have to come not necessarily from the head. That is the commonest occurrence is that most of the babies come by the head.
But it isn't a must.
It isn't a must. Sometimes the baby comes, we call it breech, the buttock first.
That's called the breech.
Yes, that is called the breech. And in that situation, we assess the mother, and if the passage is enough for the baby to come out, and if she's in labor, good contractions are coming, we allow them to have a vaginal birth, normal birth. But there are certain instances, if you think the baby is big, then the baby can't come out. And if the baby is lying across the tummy, then the baby can't come out. If the baby's hand is coming, or if the baby's forehead is coming. There are certain situations where you can't allow the baby to come out. In that instance, the only option is to deliver the baby
Through a
by a
cesarean.
cesarean section. But the breech and the head, yes,
It
they
is
are-
possible
they
for a natural birth occurrence.
even the breech is crowning when the breech is coming.
Crowning in a different sort of way.
Sounding in a different way,
Different
upside
way,
down.
yes.
This is a question that Anupama was planning
Oh,
for
yes.
me to ask, but
Oh,
this is a question that all the dads in the world would ask. Tell us, when you exactly consider in taking the pregnant mother to the hospital, what are the first signs and
That you should
what are
not
the
ignore.
exactly and what are the exactly what I was trying to say, what are the signs that you should not ignore and highlight upon?
What we have discussed a minute ago,
Yes.
as Harsha quite rightly said, the pain you should not ignore. If you are getting the pain on your back and it is radiating, that means it's going down the front in your pubic area. So that kind of pain,
That would be the first sign, is it?
first sign. And as well as I mentioned about the breaking the water
Yes.
bag and then leaking the water as well as the blood, and the reduction of the baby's movement. Suppose your baby is moving well, then suddenly baby is not moving, and then that kind of situation you should not ignore. You have to report to the hospital immediately.
Okay.
All right. So when it comes to hospitalizing and the medical demeanors that we need there, I was just wondering whether it's healthy, or do you recommend for pregnant mothers to induce labor on their own at home?
No, I don't think
Because
so.
that is a very
Yes.
majorly traditional families, like conservative families, that usually occurs. So do you recommend that medically?
no,
Okay.
not anymore.
And why?
Well, the labor can give rise to problems for the baby as well as the mother.
Like exposure for germs and things
Yes,
like that? Okay.
and so the induction of labor, there are various methods. If you go for the basics, we sometimes insert certain drugs into
Okay.
the birth passage, the vagina. Sometimes we may break the waters, and then we sometimes start a drug by a drip. So all these cannot be monitored, and there's a saying that sun should not set on a laboring mother twice. That they should not, this is an old saying,
Okay.
that laboring mother should not go on for more than 24 hours. So
Okay.
nowadays that we allow them to be in labor for a much shorter time. So if that goes beyond that time, there can be really bad consequences for the mother and the baby, and the sterility is not good. So these things cannot be done at home. So we don't recommend any home births or manipulations at home.
Yeah.
In the current context of
Yes.
today's society,
Yes.
anyways.
Yes, there is no
Yes.
heroic things that
Exactly.
we should do in
Of course not.
childbirth.
But in the modern era, we can have the childbirth underwater,
yes,
and that's a different kind of experience.
Oh, okay.
Wow.
Yep.
You can deliver your baby in the pool of water.
Okay.
Yeah.
And since the
That is-
baby is already in the water bag.
In the water bag
In the
and
water
delivering
bag.
into the water, and it says there are a lot of benefits out of that. But
I
it
need
was
to know,
done
I need
in-
to know. Oh.
Is there any
Yeah, exactly.
it was done in Sri Lanka as well
really?
before, but not in government hospitals.
There is absolutely 0% risk in it.
The risk is involved, but risk is equal to the normal delivery.
Normal delivery.
Normal delivery. There's no increased risk.
There is nothing called drowning the baby.
no,
No.
baby is already drowned in the bag of
The water bag.
Okay, because it's quite hard to comprehend the fact
Exactly.
that a baby is just giving birth inside water. I mean, is there any other way that you could describe it to the viewers out there, because all of them are laymen at this?
Yes.
How does a baby be born inside water? How do you exactly put that
Yeah,
out?
we do the monitoring of the baby and the mother
Okay.
as usual, but
Uh-huh.
closer to the, because water is a soothing thing, and when you immerse in the pool of water,
Okay.
then